Phlebotomy is a technique in which a needle is temporarily inserted into a vein to provide venous access for venous blood sampling. It is a commonly used method to collect blood for laboratory tests. Before you start, introduce yourself to the patient. Check patient's ID. Explain the procedure and gain consent.
Hello, I'm your Dr. Nurgül Yavuz. May I please ask your full name? Welcome, Öykü Hanım. Today I should take your blood to measure your blood glucose level. This is a short procedure. You might feel some pain, but don't worry about it. It's generally not a problem, okay? So, do you have any allergies?
No.
And have you ever experienced any problem during the procedure? Perfect. And have you eaten or drunk anything past few hours?
No.
Okay, so do I have your consent to do that?
Yeah. Yes.
Perfect, we can start.
Gather the equipment. During this procedure, you will need following equipments: hand hygiene materials, syringe, gauze, cotton wool ball to be applied over puncture site, alcohol, tourniquet, well-fitting non-sterile gloves, sharp container. Check the expiry dates and integrity of the packaging. Position the patient. Hyperextend the patient's arm. Select the phlebotomy site. Extend the patient's arm and inspect the antecubital fossa or forearm. Locate a vein of a good size that is visible, straight and clear. Perform hand hygiene and put on well-fitting non-sterile gloves. Disinfect the entry site. Clean the site with an alcohol swab for 30 seconds and allow to dry completely for another 30 seconds. Apply firm but gentle pressure. Start from the center of the venipuncture site and work downward and outwards to cover an area of 2 cm or more. Allow the area to dry. Attach needle to syringe. Apply the tourniquet about 4-5 fingers above the venipuncture site and re-examine the vein by inspection. If you need to palpate again, disinfect the site once more. Remove the needle cap carefully. Grasp the patient's arm firmly using thumb to draw the skin taut below the venipuncture site and anchor the vein. Insert the needle swiftly through the skin and into the lumen of the vein. Avoid trauma and excessive probing. The needle should form a 15 to 30 degree angle with the surface of the arm. Draw sufficient blood. Once sufficient blood collected, release the tourniquet before withdrawing the needle. Withdraw the needle gently and apply gentle pressure to the site with a clean gauze or dry cotton wool ball. Ask the patient to hold the gauze or cotton wool in place, applying pressure on the area for 3 minutes with the arm extended and raised. Check the patient and inspect insertion site to verify that it is not bleeding. Inform the patient when the procedure is over. Discard used items properly. Especially discard the used needle and syringe or blood sampling device into a puncture-resistant sharps container. Perform hand hygiene again. Risks for patient: infection at blood sampling, pain at blood sampling site, hematoma or thrombus, extensive bleeding, nerve damage, vasovagal reaction, fainting, allergies. Risks for health worker: needle or sharp injury during or after the procedure, splashes, exposure to the blood. Risks for blood specimen: hemolysis,